Good morning, everyone. We're going to call the Health and Human Services Committee meeting to order. Madam Clerk, please call the roll.
Alderman Boardman.
Present.
Alderman Boyd.
Present.
Alderman Williamson.
Here.
Alderwoman Behringer.
Present.
Alderman Cone. Alderwoman Howard.
Present.
Alderman Arnowitz.
Here.
Alderwoman Hubbard. Chairwoman Flowers.
Present.
7 present. You have a quorum.
Thank you. I know there's another committee hearing that's going to start at 10 a.m., so we're going to lose a member, but that's okay. I think from looking at the list of people that want to speak today, we're going to be here, I think, when they get back. I don't know how long. We'll definitely, I think we'll be here, so they'll get some information. So we're going to go ahead and get started on Board Bill 169. Which one is the paper bill? Okay. All right. And I'm going to call Karen up. If you would come up. Yes. You want to start off? Are you doing this presentation? Okay, very good. If you would go to the microphone and state your name and who you're representing so the committee members will know.
Good morning. My name is Karen Englert. I am the Government Relations Director for the American Heart Association. I represent all of our prevention policy in the state of Missouri. I want to thank you for the opportunity to speak to you this morning on Board Bill 169 and 170 to talk to you more about Tobacco 21. So we've prepared a presentation that I'll be going over, and then there's many people here today that also want to speak to you about why this prevention policy is so important to them. To talk about why Tobacco 21 has kind of turned into what it has, how it really can help prevent nicotine and tobacco addiction, and why we think it is so beneficial for the city of St. Louis.
Okay, Karen, if you could try when you speak to make sure you're speaking near the microphone so that the taping can pick it up so people can actually see that that's not here, okay?
Okay, thanks.
Thank you.
So it's important for us to understand the problem, why we need to address tobacco use, especially with our teens. And so that's what I want to talk about for a few minutes right now. So we know that 95% of current smokers started before they were 21 years old, which seems a little odd considering that, right now the current age to buy tobacco products is in fact 18. But yet 95% of smokers started before they were 21. We also know that when people have their first cigarette, by the time they're 18 years old, they are twice as likely to become a lifelong smoker, which means they are twice as likely to deal with addiction, with chronic disease, with increased health costs, with endangering the people around them from secondhand smoke, with increased absenteeism from work. So there's so many issues that come with being a lifelong smoker. We've also seen recently that youth rates of smoking have increased, which is very troubling to us. We had seen a decline. Starting in about 2007, we actually saw those rates going down, which was very promising to us. But starting in about 2014 and 15, we're now seeing those rates go back up. And so we really want to talk more about why we're seeing that. Yeah. Oh, I'm sorry. I am all over the place, a mess.
Yeah, just if we could slide this away from the camera.
Sure. Move me wherever you need to.
Sorry about that. The camera won't. It looks like. Okay, all right. I gotta move it around. I've got one in the direction.
Okay, that goes. There you go.
Which microphone do you want me to use?
The one that's working.
Okay. Okay. I think that one is. Okay, we'll try this one. Sorry about that, everyone. So in Missouri, we know we have a problem with smoking. We know we also have a problem with youth smoking. Right now, currently, about 17% of our high school seniors are already smokers, which is higher than the national norm. So nationally, we know that about 14% of high school students are smokers. In Missouri, unfortunately, we are above that norm. It's not a norm we want to be above. We want to look for ways to reduce our high school students smoking. So as I mentioned, we had seen kind of a decline in smoking, and then all of a sudden we saw kind of an increase again. So I want to talk you through this slide a little bit. I know it is busy, but there's some really good data in here. So if we look at a couple different columns, all the way to the left of the slide, there's a column that says any. And so this talks about the estimated percentage of high school students using any tobacco products. Okay, so that's any product the FDA, the Food and Drug Administration, deems a tobacco product. Regular cigarettes, pipes, cigars, e-cigarettes, hookah, things like that. So kind of that any column. And if you will notice, this is a span of over 4 years, so 2011 to 2015. 2011 is all the way in the white, 2015 in that dark blue. And you'll notice there was a decline for several years. And then again in 2014 and 15, we saw that jump. We're seeing an increase again. So now if you jump over a couple columns, you see e-cigarettes. And e-cigarettes, unfortunately, we have seen an increase year after year after year, especially in 2014 and 2015. So the e-cigarette column is the third column over, and if you look at that, I mean, that is a staggering increase. That shows us what our teens are using the most, and that is exceptionally troubling. You also see that while regular cigarettes had declined for several years in 14 and 15, that decline kind of leveled out. So again, we are seeing our youth using tobacco products more than they have been in the past, and we have to figure out, how do we address this issue? How do we keep tobacco products out of the hands of our youth? Because this is very troubling. So then we talk about, well, if there's a problem, how do we fix it? And that's Tobacco 21. So the story of Tobacco 21 is one that I personally kind of find a little bit funny. So 2 guys in a car. Like, that's kind of the background of Tobacco 21, and there's a lot of funny stories that could be told about that, right? 2 guys in a car. But it was 2 Harvard professors of pediatrics that really began to talk about what are all the problems we see with youth who smoke. Because there's so many, if you really think about it. Increased rates of asthma, chronic disease, struggles with getting employment. I mean, there's a lot of health impact, but other impact too. And so, you know, they have this conversation, and it evolves, and it evolves, and it turns into what we now call Tobacco 21. So as I mentioned before, Tobacco 21 originated in Needham, Massachusetts. And I'll be really honest with you, Needham looks nothing like the city of St. Louis. It doesn't. It is a sleepy little town in the suburb of Boston. Needham, Massachusetts is about 2 miles long. Teens could walk across the street to buy a tobacco product somewhere else if they wanted to. The beauty, though, of Needham, Massachusetts is that they passed this ordinance, Tobacco 21, and then they just watched to see what would happen. And no other ordinance was passed for many, many years. And so we got to just use Needham as a case study to see, is this really going to work? And so that's kind of one of the best things that we can do is, right, we change something and then we just intensely study it. We don't change any other thing, because when you change nothing else, you really get to see, is this going to work or not? And we saw it worked, and it worked really, really well. So during this time, we had seen that youth rates were declining. I had said that. overall, they were declining, which is very positive. But when you look at the difference in the decline, that is what is so astonishing. So the top line, the full line, talks about the Metro West, kind of that Boston area, with youth rates declining. So this talks about the decline from 2006 to 2010. Unfortunately, we saw those rates declining, which is very positive. But then if you look down and you look at Needham, Massachusetts, and you look at what happened again in that one city where we raised the age by 3 years, 48% reduction in youth smoking rates. So nearly double the reduction in youth smoking rates. And again, these youth could go across the street, basically. I mean, that city was 2 miles long. So they could have gotten tobacco products somewhere else, but they didn't. So almost double the rate of change there. So then when they really began to look at, okay, well, what happens then if we look kind of long term at what this change could mean for lots and lots of places? And so the study was done on the public health implications of raising the minimum age. Because after they began to look at Needham, other cities really kind of started to take hold of this. And so they did this study, which was also very, very informative. So we saw that the biggest age group that would be impacted by a decrease in initiation is that 15 to 17-year-old age group. A 25% reduction. And this isn't in one little bitty city. This is not talking about a 2-mile stretch of a city. This is nationwide. A 25% reduction in initiation. So 1/4 less of our youth would start smoking. So 1/4 less of our youth being addicted to the #1 cause of preventable death. Talk about an impact. Talk about a significant change. The study, they looked at the impact, if we looked at it, all the way through the year of 2100. And so they looked at it and they saw over 2,200 fewer premature deaths. That is very, very significant. But most significant, they found that 4.2 million years of lives would be saved. 4.2 million years of lives nationwide could be saved. So Needham, when they did this, they saw declines in all sorts of things. They saw declines in teen smoking, in adult smoking, in smoking during pregnancy, and a lower mortality from lung cancer. So the results from Needham were very positive, and that caused other cities to take a look and say, maybe we want to do that too. So in Missouri, we decided to do that too. And the first city to enact Tobacco 21 was Columbia, Missouri. We now have 8 cities, 8 communities in Missouri that have Tobacco 21. And in Columbia, Missouri, kind of the same thing. They saw a problem and they wanted to fix it. So a local member of a school board approached a councilwoman and said, I want tobacco out of our schools. Our youth are being hurt by this product. And that council, being very responsive to a community need, adopted Tobacco 21. And to me, that is a powerful, powerful move. When you see a need and you address a need. And that is what happened in Columbia. And since then, 8 communities in Missouri have done the same thing. So when you look at Needham and then you look at all these other cities, you ask, well, why is this so effective? You know, we do lots of things in tobacco control, but why is this so effective? Why does this work so well? And the reason is that we take away the social source of tobacco products, of all tobacco products from our teens. So in Missouri, we know that 80% of high school seniors are already 18 by the time they graduate. And youth initiation is 13. Here in Missouri, kids start smoking, they start trying cigarettes and tobacco products at 13 years of age. So if we have 18-year-olds, 80% are already 18 by the time they graduate, and kids are trying tobacco products at 13, and then we think of our school system where we have middle school, junior high, and high schoolers often overlapping in activities. Those young kids have access to tobacco products very, very easily. But if we can raise that age by just 3 years, we eliminate that social source. because it's pretty rare that you will see a 21-year-old spending a lot of time with a 13-year-old. I have kids at home. I have a 14-year-old and a 20-year-old. Those two do not hang out. If we look statewide at Missouri and tobacco control, we know that Missouri statewide, we have some work to do statewide. The tobacco industry has done a good job lobbying here, and we know that. We continue to have the lowest tax, and cigarettes are very, very cheap. So at a state level, there's some room to do more work. But locally, we have seen tremendous things from our local governments, from our local bodies, being very responsive to the needs of their community members. You know your communities. You know the struggles they face. You know that healthcare is a struggle. You know that smoking is a struggle. And you know that this is a way that you can help your community members. And we have seen that over and over with Tobacco 21 in Missouri now. 8 communities have already responded to this need. Tobacco 21 has gained a national movement. It's now in 211 communities nationwide. Washington, D.C. just adopted it this past week, November 1st. It's in 14 different states. It's in 2 states as a statewide ordinance. And there's talk in Congress about making it a national policy. We recognize this is a way to prevent youth addiction, a significant way to prevent youth addiction. And there's a way here in the city of St. Louis that you can do the same thing. So this slide is, for me, is important, again, because I'm kind of a nerd and I like numbers. But when we look at lives saved by Tobacco 21, this talks about the population that's currently covered by Tobacco 21 here in Missouri, almost 2 million residents, very, very significant. But when you kind of go down and you look at that number of 440, I want you to look at that one a minute, because that one talks about the number of lives here in the city of St. Louis that would be saved by the enactment of Tobacco 21 here in your city. So that's 440 youth. That is 440 of your children in this community of lives that would be saved by the enactment of Tobacco 21 here. And that's powerful. Those are your community members. So when we talk about Tobacco 21, it's important to know who supports it and why they support it. Because again, it's a change, and we recognize that. That is a change. And so we look at kind of this survey. This was a national survey done by Jonathan Winnickoff. It was done in 2013. The results were published in 2015. And support for Tobacco 21 was at 70%. Support for the age to buy tobacco should be raised to 21. This is another one. Do you favor or oppose raising the legal minimum age to purchase tobacco products? Again, the combined in favor, 75%. This one talks about people who smoke versus people who don't smoke. Again, we wanted to know, people who use this product, would they support this? And 70% supported this change. So current smokers support this change. There's actually less than 10 percentage points difference between people who have never smoked, a former smoker, and a current smoker in terms of supporting raising the legal sale age. When you talk to a lot of smokers, they wish they had never started to smoke because they struggle so much with that addiction at this point. So that's kind of the broad base support. But then let's talk locally, right? Because we want to know who here in St. Louis supports this. And you have a list of endorsers in your folder that was provided, but here they are again. Because it's really important to know, okay, if I'm going to make this change, why? Why should I do it? Who here wants me to do it? This is who wants you to do it. This is businesses and organizations who want you to make this change. These are the people that want you to make this change. Businesses want you to make this change because the cost of hiring smokers is it's hard on them. The cost of smokers is almost $6,000 more than a non-smoker. And businesses are dealing with that day after day right now. When we look at General Motors and they talk about the cost of healthcare is more than their cost of steel. They're starting to get very creative in how they can reduce those costs. And so they look for ways to do that. Tobacco 21 is one way to do that. There's many ways, but this is one way to do that. Now, certainly we know there will be opposition when we look to make a change, right? You can't make a change and people won't say anything. But opposition has been very, very low. Occasionally, opposition we get is that it will decrease city sales tax and it will hurt business. And that's a fair statement. But it's important to look at really what that means in terms of the numbers again. So tobacco is not a major portion of sales tax revenue, right? So we tax very low here in the state of Missouri, only 17 cents a pack. And when you look at statewide tobacco, it's only 0.09 of all retail sales. So it's a very, very low tax. And then you look at consumers, that 18 to 20-year-old bracket, that we would be kind of shifting out of that market, and it's 2%. So 2% of 0.09. I'm not great at math, but that's really, really low percentage. The most common argument, though, we get is about what some people consider to be a civil liberty. And I do want to talk about that a minute. So old enough to vote, old enough to fight, you should be old enough to buy tobacco products. So we already have ages in place for lots of things, right? We have ages in place to buy alcohol. We have ages in place to go to a casino. We have ages in place even to rent a car, to rent a hotel room. Ages in place to be an alderperson. We have ages in place to be a senator, a state rep. We have ages in place for many, many things. More than that, though, as a wife of a veteran and a daughter of a veteran, I really struggle with saying that because you fought in a war, you have now the right and civil liberty to be addicted to the most harmful substance, the most addictive substance. I struggle with that. I do not see the correlation between the two. There is absolutely no freedom that comes from addiction. Addiction takes away freedoms. It takes away civil liberties. And the military is working very hard to reduce and eliminate tobacco from their military bases, from their trainings, because now they are dealing with people coming into the military not able to serve. So Tobacco 21, this is an opportunity to enact a prevention policy. That's what this is. This is about preventing addiction. And that is what we hope you will vote yes on with 169 and 170. The bills are virtually identical. It is a simple language issue between traditional tobacco products and newer tobacco products, basically. But we are happy to answer any questions. And again, there are lots of people here today that want to speak to you as well. So thank you for giving me so much time.
Okay, thank you. Thank you very much, Karen. At this time, we're going to take a roll call just so that we can, if I do lose a quorum, that we can still hear Board Bill 170. So, Donna, would you please call the roll?
Alderman Ortman,
President.
So this is a roll call to continue discussion of Board Bills 169 and 170. That's all this is, not a vote for or against. It's just so that we can, if I lose a quorum after Board Bill 169 is talked about to hear 170, then I have to call another hearing.
Why don't I move that we put Board Bill 169 in front of us?
So there was a motion to put Board Bill 169 before us. It was seconded by Alderman Boyd. Please call the roll.
Alderman Ortman,
Aye.
Alderman Boyd,
Aye.
Alderman Williamson,
Aye.
Alderwoman Behringer, Alderman Cone, Alderwoman Howard, Alderman Arnowitz,
Aye.
Alderwoman Hubbard, Chairwoman Flowers.
Aye.
6 aye vote.
Okay, thank you very much. I've seen, oh no, I thought I saw somebody new walk in the room. If anyone is new coming into the hearing and would like to speak, I have sign-up sheets. In order for you to speak, you have to be on the sign-up sheet. So would you like to speak, or are you just here to hear? Okay, because there was a conditional use hearing that was gonna be held in here and got moved across the street, across the way. So if there's anyone here for a conditional use hearing, that is in room 230. Okay, at this time, we're gonna have Teresa Schwartz, if you would, come up, and she's going to speak next. Now, why don't, if you're not doing anything in reference to that, we're gonna move the microphones back over on the podium.
The one that works. I think it's that, yeah, sure, it's that one.
I'm shorter than the mic that works. Is that a problem? Right, we'll make it happen. Thank you.
All right, welcome, Teresa. If you can state
you.
your name and who you're representing today.
Absolutely. Good morning. My name is Dr. Teresa Schwartz. I'm a breast surgical oncologist at St. Louis University, and I'm also the state chair for the Commission on Cancer here in Missouri. So I'm speaking today on behalf of both SSM Health St. Louis University, St. Louis University School of Medicine, and our Cancer Center. As a cancer surgeon and a physician who sees the effects cancer can have on ultimately all members of society, I have a tremendous interest in working to eradicate all preventable causes of cancer-related deaths, and lung cancer is at the top of that list. Research has shown time and time again that smoking dramatically increases a person's risk of developing a cancer, and it's well known that nearly 90% of lung cancer diagnoses are linked to smoking. The American Cancer Society estimates that people who smoke are 25 times more likely to develop lung cancer than a non-smoker, and well over half of the people who develop lung cancer will die of lung cancer. Smoking also increases the risk of bladder, head and neck, kidney, pancreas cancer, not to mention the increased risk of heart disease, peripheral vascular disease, stroke, and chronic lung diseases in smokers, all debilitating and chronic diseases, all irreversible if a person continues to smoke, and all amazingly expensive to the city of St. Louis and to the state of Missouri. There are $3 billion in healthcare expenditures each year in Missouri as a direct result of tobacco use. $3 billion. In addition to these astronomical healthcare costs that are associated with smoking that are incurred on a personal, local, state, and national level, smoking has a significant impact on a smoker's family. Children of smokers have a greater chance of developing colds, ear infections, asthma, bronchitis, pneumonia, all of which result in multiple expensive hospitalizations, missed days of work, missed days of school. And those children end up having a higher risk of becoming a smoker themselves. And babies exposed to smoke have a higher risk of sudden infant death syndrome, as well as lung infections. And while there is a perception that smoking can decrease anxiety and improve mood, there is research that has shown that smoking is associated with lower physical, mental, and social functioning, and an increased risk of depression. And while all of this information may suggest that the horrendous effects of tobacco use are an adult problem, as we just saw on those slides earlier, it's important to note that more than 95% of long-term smokers started before the age of 21. So the developing brains of the future leaders of this city are exquisitely vulnerable to the effects of nicotine. Nicotine affects the adolescent brain more rapidly, making it much easier for them to become addicted. E-cigarettes are full of nicotine. We don't know from one product to another how much, but they are not nicotine-free. They also have cancer-causing toxins. The FDA defines e-cigarettes as a tobacco product, and for all intents and purposes, e-cigarettes are just as dangerous as standard cigarettes to the St. Louis City youth. And unfortunately, as you also saw, e-cigarette use has only continued to climb, and this effectively hooks the minds of children in this city on nicotine, and then also connects them to that smoking process. You may hear tobacco supporters voice concern that increasing the tobacco age from 18 to 21 is a restriction of personal liberties and freedom. I find this quite ironic when the very addictive tobacco products in question more effectively rob our 18 to 21-year-olds of their liberties and freedom. When asked, most smokers would like to quit. Most have unsuccessfully tried to quit numerous times. Most regret ever starting to smoke. Their addiction to the tobacco product has restricted their personal liberty and freedom, not the age at which they were allowed to purchase them. And what about the liberties and freedom of the infants and children that are subjected to the risks of smoking against their will? Our youth who are in high schools and being peer pressured into smoking at an earlier age. Do the tobacco supporters care about those civil liberties? They don't, but the city of St. Louis should. It is ultimately in the best interest of all who work, live, and thrive in St. Louis City to increase the purchase age for all tobacco products, which include e-cigarettes, from 18 to 21. Thank you for your time.
Thank you, Dr. Schwartz. Does anyone, I should have asked this of Karen, does anyone have any questions of Dr. Schwartz? Anyone on the committee? Do you have a question? I'm gonna bring her up after, okay, no questions for you, thank you. Karen, if you could come up, please. Looks like we have a question for you. That's okay, I forgot. I was gonna do all three presenters, and I thought, you just gave a lot of statistical information. So people might wanna ask you, because I wrote a question down too. Yes, Alderman Boyd.
Yes.
Move your microphone. There you go.
Thank you. I'm curious as to what the data shows currently in the urban cities that have adopted the Tobacco 21 policy, such as Chicago and Kansas City. Do we have any data right now to show how successful it is?
We don't have any in terms of long-term. We always like to look at least 5 years of data. I think that's just always, it's a safe way to do things before we make long-term decisions about that. So no, I know that we have, preliminary reports have been very, very positive, but we do not have that at least 5 years minimum data yet, because again, there was a big gap after that 2005 in Needham, and then kind of the next one started in like 2012, 13. That's when we kind of saw those next big pushes of communities to adopt that policy.
Okay. I remember going into the Army back in 1982, and quite a few of the soldiers that I went through training with didn't start smoking until they came to basic training. I'm finding that most people that I talk to smoke because of stress. And I'm hoping one day we find a replacement for smoking rather than just, taking these steps to raise the age and so on and so forth. You said something that was very interesting before you ended your presentation. You said something about military bases are looking at taking tobacco products off the shelves, kind of, sort of, I'm paraphrasing. And then you said something about people coming into the military are unable to serve. What did you mean by that?
So we are seeing reports from a lot of the different military agencies that right now they're actually having to lower some of their standards as far as like the tests that they're giving to a lot of the incoming recruits, because their physical capacity doesn't meet the old standards that you probably went through in 1982, that my husband went through when he went in to serve, and it's for a variety of reasons. But we're seeing, unfortunately, a lot of health trends declining overall in the United States, not just related to tobacco, but also just to physical aptitude. They can't run as fast, as long, obesity rates, just there's a lot of physical issues. But one of the steps that the military has taken is to eliminate tobacco during basic training.
I guess I'm trying to help me with the connection, the correlation between the military being concerned about tobacco use and not being able to serve. I mean, it could be a variety of issues why someone can't run as fast, like they don't have recess and they don't have these physical activities in school anymore.
Okay.
So I'm disconnected with what you were suggesting.
So when a person is a smoker, especially a chronic smoker, then their lung capacity is lower. They cannot run as far.
Okay.
They cannot run as fast.
And the military has data that suggests this is occurring with people who have enlisted who are smokers?
Yes.
Okay. All right. Thank you.
Oh, absolutely. I'm sorry I was not more clear.
Okay. No further questions.
Are there any more questions for Karen from the committee? Okay, thank you very much. Oh, I'm sorry. Larry, I didn't see you.
Just a couple things to follow up on Alderman Boyd's. You don't think a lot of them reasons by the military saying about lowering their standards wouldn't be because a lot of youth nowadays between the ages of 13 and 17 are on computer games all day long. They don't go out and exercise and things like that.
Oh, I do. That's what I said. There's a variety of reasons. Absolutely. But I think the steps that they are taking, though, when you look at eliminating tobacco from basic training, I don't think they would be looking at doing that if they did not see tobacco as a correlating factor.
And the other thing is, you really believe by raising the age of 21, kids that are smokers won't find a way to get someone to buy them for them?
Absolutely not. But I also think, you know, I'm a mother. I'm raising 4 teenagers, and my kids are going to make bad decisions. They're going to break the rules. It doesn't mean I don't set the rules, though, right? I mean, I have to do that. And so we have to do that. I have to look for ways to protect my kids, knowing that, yes, sometimes they will still not follow the rules that I set.
Well,
You
I
still
mean,
have to set them.
I can make the same argument. I'm a father and grandfather, and I try to set rules, but my wife overrules me a lot.
Well, you
and
sound
I
like
don't-
my husband on that.
I'm fortunate my kids don't smoke. They tried it, didn't like it, and quit smoking. I never smoke around my granddaughter. I don't even smoke in the house. I smoke outside. I understand the trend of everything going to, you know, lung cancer from tobacco kills you. Whoever said it, you don't have to be a smoker to get lung cancer. You don't even have to be a smoker to get cancer.
correct.
Cancer just runs, and if you're the unfortunate person it happens to, it happens. I started smoking when I was about 16, I'll be honest with you. I've quit smoking 5 or 6 times during my life, and I just stopped cold turkey. Let me tell you why I went back to smoking. I gained about 180 pounds because you're always snacking and picking. So it's kind of like darn if you do and darn if you don't. It is an addiction, but we have addictions in this city and state of drugs, alcohol, and everything else. But I mean, I understand. Here's my theory all along. Secondhand smoke kills you. I've never seen a death certificate that says that. I mean, how do you prove someone dies from secondhand smoke? That's my whole point. I'm not against the smoking thing, raising it to 21. I know it's not going to stop kids from getting it. But on the other hand, being a veteran in 1971, you know, you tell these young kids that's in the Vietnam War, served over there in Iraq and everywhere else, when you're out there fighting, you're scared at 17 and 18 years old. And for people to get up and say that's just an excuse for smoking, no, that's not an excuse. You smoke, you get relaxed, you're nervous. You're getting shot at. I mean, there's other factors. I mean, when you're old enough to serve, to me, you should be old enough to do whatever. And that's just the way it is. So my point, why don't we raise the enlistment age to 21? Why don't we raise the voting age to 21? So if we want to do everything to 21, let's do it all. And just make it fair. I mean, I'm just being honest. I'll vote for the bill in committee. I don't know how I'll vote for it on the floor until I talk to my constituents. But that's what I see.
Well, and I really appreciate, 1, your comments, and 2, your service. I mean, the service of many of you. You know, my father was in Vietnam. He dealt with a lot of those exact same issues. And unfortunately, he then became a longtime smoker. He dealt with those same things. And he never wanted his children to start smoking. And so that's what this is about, is keeping our kids from ever starting to smoke. Because he knew how hard it was for him to quit. And so that's really what this is about, is making sure that, you know, our youth don't deal with the same things that maybe you've dealt with or we dealt with. And so that is our focus here. That's our goal here. But I do appreciate your service and your comments. It's very much appreciated.
Okay, thank you, Alderman. Alderman Ortman? Sorry, I'm not going in order. I'm just looking at the ones that said they have questions. Go ahead, Alderman Ortman.
I don't know that I really have a question. I just want to, you know, follow up a little bit. And I had to leave and come back, so you got to kind of catch up where you are. I could probably be your father because I served in the Vietnam Air. And, you know, back then in the combat zone, it was $1.30 a carton, 13 cents a pack. Just to let you know how convenient it was for the military and all men. At that time, I happened to be stationed on an aircraft carrier. And when you're out there 30, 35 days at a time, there's, you know, I mean, you smoke. That's one of the things you do, and I think all of us did. Fortunately, my body always kind of rejected it, so I never became a full-time smoker. I kind of was an off and on person, and every time I'd start again, it's like, oh, why am I doing this? You know, but I kind of look at it, and I support this, and there's probably no opposition in the room, which is great. I kind of look at it just like seat belts. When my oldest son is like 32, when he was a kid, first we went through this with the seat belt laws, you know, and you have to instill in the children that, you know, when they get in, they have to put a seat belt on. That's exactly what we're doing now. Will they find some place to find it if they want to smoke? Before I was 13, one of my friends in the neighborhood and I, both of our fathers smoked L&M. You know, I would borrow a pack from my father's carton, and then he would borrow a pack from his, and we'd hide them, and that's how we smoked. Made me sick. I have no idea why I even wanted to do it or try it, but that's what all the parents did at that time. You know, so I think it's important to do this as far as, you know, the other about, you know, voting or serving. I mean, I went in when I was 19. You had to be 21 to drink, but on base you could be 18. So, I mean, it was even a little conflicting there with alcohol, and when you're in and you're somewhere strange, I mean, you drink a lot too, you know, and I would hope that the military would kind of try to get a cap on that too, because we have a lot of alcoholics that come out as veterans and so also. So, but I think what you're doing is great, and I want to thank everyone. I probably have to leave around 11 o'clock, so it looks like we might be here till noon, or some of us. So, but I just wanted to take the opportunity to say thank you and you know, for bringing this forward. The one thing I'd really like to see, and I know we have legislation about selling single cigarettes. In my ward, we still run into that occasionally. You know, I mean, and we're the legislators, but I think we need to take another look at it. When these guys get caught, they need a stiffer penalty.
Okay. Yes. Alderwoman Behringer?
I'm not sure who can answer this, but here's my question. Correct me if I'm wrong, and that's why this may be for a doctor that's sitting out there. Haven't they proven that your frontal lobe is still not completely formed until a certain age? I know that they talk about that when we talk about alcohol and pot. Wouldn't that be the same case as cigarettes? And that's all I'm asking.
Yes, and so that is one of our major concern, or reasons why this is so important, is that brain development really is still very much happening with our youth during this time. And that's why, you know, we don't mean to be kind of easygoing when we say kids, but their brains really are still kids during this time. And so when we look at brain development, if we can wait, you know, and get them to 21, really if we can get them to 25, but that's kind of pie in the sky, that gives brain development a much better chance of having that kind of full formation. And so the chances of them then becoming long-term smokers, it's virtually, I mean, it's so dramatically reduced because of brain development during that time. So that is a great question. I know one of the doctors, there's many, will give you much better statistics on that, but yes, you are correct.
Okay, that's it. Thank
Okay,
you.
Thank you very much. Alderman, you said you can be here until 11:30? Okay, very good. That's 11. Okay,
right,
all right.
thank
Thank you,
you.
Karen, appreciate it. Okay, at this time, Jenny Chadwick, if you would come up and please speak, and then after that, we're going to call everyone up on the list. It's just I know that these are the people I've been meeting with in discussion of the bill. I knew they had presentations, and I thought the information would be good to hear, and then we will take everyone else that has spoke up, signed up to speak. Thank you.
Hi, I'm Ginny Chadwick. I was the council representative in Columbia, Missouri that was the bill sponsor, have worked with Kansas City and the greater Kansas City area, now 19 cities within the greater Kansas City metropolitan area. When you heard 8 in Missouri, some of them are on the Missouri side, some of them are on the Kansas side. So 1.5 million people in the greater Kansas City area, Columbia, Missouri, and St. Louis County being 1 million people have adopted this policy. When we talk about do we have real prevalence rates, real predictions, when Karen showed the slide showing the Institute of Medicine report, it was that pink book. So President Obama in 2009, he signed the Family Smoking and Prevention Control Act, and when he did, he specifically asked for a report, a national report, to find out what the implications would be of changing the age, and he looked at 19, he looked at 21, and they actually looked at 25, knowing that brains are still developing until 25. And what they found was, so the Institute of Medicine did a 4-year study. So that little graph that you see isn't a little graph. It's really a 400-page book of thousands of contributions of doctors across the entire country looking to see what the implications. So yeah, we only have 5 years of prevalence data from Needham, Massachusetts, because the next place to pass it, nobody touched the ordinance for 5 years. They honestly didn't think it would work. I have doctors out of Stanford, Harvard, that were just like, we don't really know if this policy will work, but then when they saw the report of how much it really did work, then they did that Institute of Medicine report, and they found, wow, it really does matter. 25% reduction in initiation. A sales tax increase doesn't touch that. Marketing doesn't touch that. Education doesn't touch that. Indoor air ordinances don't give us that huge jump in reduction in youth initiation. So, and then we look at the military question, like readiness, civil liberties, like I get it. So Hawaii was the first state to pass this, and it's a huge military state, right? And when they passed this, I actually just presented at a national conference 2 days ago with the woman who was the champion for Hawaii, and her husband's in the military. And when the state passed it, the state is a state law, right? The military base is a federal base. They didn't have to comply with the law, and they didn't know if the military bases in Hawaii would comply. And the military came out and they said, we want our soldiers ready. And tobacco products are not what we want. Basic training is now 100% tobacco free. They're trying to reduce use of tobacco products, and the military bases are all applying and adopting the Tobacco 21 law. So that's been in effect now for almost a year. So the military supports Tobacco 21, and they made a really clear statement in Hawaii to do so. So if you have any questions specifically to, we find that indoor air ordinance is a pretty complicated, challenging policy as far as opposition. You're looking in the room, there's not a single opposition to this. Every community that's passed this, 211, New York City, San Francisco, Chicago, they tell me it was easy, oddly. I'm not exactly sure why, but it was. So here's an ordinance before you that will really prevent. It's a prevention ordinance. We don't want our youth to start, so we just move up the age.
Okay.
Questions?
Okay, do we have any questions of Ms. Jennings?
No, I just have a comment.
Yes.
Sorry. My son is stationed at K-Bay. He's active military Marine, and I just assumed all the bases were like that because I've been there. They don't allow it. It's not allowed. So now you've clarified why K-Bay is like that. Thank you.
Okay, thank you. I'm gonna be slowly losing a quorum, and if I have people that are willing to support this bill before they leave and we can get it out of committee and get it to the full board in a couple of weeks, I want to give everyone the opportunity to speak, but if I have to take a vote, I need to take a vote, okay? So I don't have anyone signed up that's against it, and I have plenty of paper information, but it's one thing I wanted to share before some left. I wanted to visit some of the vape stores. I didn't get to visit a vape store in the city. It looks like there are about 4 or 5 of them in the city. So I went to a gas station in my ward yesterday, and because I wanted to see what this vape cigarette looked like. And interesting enough, the attendant was just hell-bent on getting me a pink one, because I think he thought it would be cute for me. And of course, there was just a blue one. So I just kind of wanted to see, and it was in this beautiful glass case on the floor of the gas station. It was locked up. That kind of reminded me as a little girl of a little Cinderella doll house that I had. And so I looked at the different juice that you put in it, and I've looked online, and I've seen everything from Fruit Loops to cereal to marshmallow flavor to all these wonderful flavors. And so I like birthday cake, honestly, and apparently my son loves birthday cake. He's 4 years old, and I just want to pass this out to the committee members because I didn't smoke it, but if you smell it, it smells better than birthday cake itself. And my son wanted to lick it. So apparently, and I have strawberry, which we know strawberries in other products as well, adult products, lotion, all kinds of things. But if you smell it too. And unfortunately, when I opened it up this morning, I got it all over my face, so now it's all over my lips. This is some horrible stuff. But the strawberry smells pretty good too. So apparently you're supposed to load this juice into this vape thing, and then you screw it up like this. I mean, this thing is heavy. I mean, there's nothing sexy about it. It's quite heavy, and I just can't imagine myself smoking this thing somewhere and thinking I'm cool or sexy. And the other really convenient thing is you can actually put it in your like your charger, like a phone charger, which is really convenient because all our kids have phones. So it makes it really easy to charge it up. And apparently you need heat to do so in order to get the good vape, I guess, out of it. So I'm going to pass this around so you all can look at it. And this one was $40, $39.99. I saw one that was $9.99. And I told the owner I'm not going to tell him anyone where I got it from, so don't ask me where I got it from, okay? But he said, honestly, they sell about one a month. But still, a kid can go online and get this. I was reading the ordinance. Apparently, maybe you can get this even in a vending machine in certain places. We have to have signage if this passes so that the youth are aware of it. And in the bill, there are penalties if you are caught as I call our convenience stores, sometimes I call them cover-up stores, so that they will be penalized for doing this. Now, the one thing that the county just passed this September the 6th, and in their ordinance and in the county, they apparently have a little bit more enforcement in the county. Meaning, they have the department that goes out and able to inspect these vape stores, which right now they're having trouble regulating them because you don't really necessarily apply for a vape store occupancy permit. So it's kind of hard to keep up. But I think when we had the last meeting, they think that they had maybe 256 vape stores. Compared to about 5 or so in the city. I know some aldermen have expressed they have them in their wards, and I'm not going to, hey, I don't know. I still want to go see the vape store and just see what it looks like. But I know in my community, anyone that wants to open up a gas station or a convenience store, I tell them I will not support it if you put these cigarette signs that are about 3 or 4 feet tall all over the place, because I think it's absolutely humiliating that we can't go in and price cigarettes like we do any other product, and that's the only way that we're going to go in and buy a cigarette product. So I try to tell my businesses, look, I don't want that, don't put that up, and from my understanding, they get paid from the tobacco companies to do that. That's part of their promotion. And then in learning about this bill, it really is, and I didn't look at it this way, it's a way to get our youth that are growing up to look at this big green and white sign to say, hey, look at that. That's something that, you growing up seeing, thinking that that's acceptable in your community and maybe that's a product you want to buy. And I do believe, and I think we also had a discussion that a lot of these vape stores, and I don't know, you all have them in your ward, are close to schools, that a lot of the marketing is to our lower income minority communities. I saw Alderman Boyd asked about any statistic in our cities, which I'd be interested in, but I do know that the businesses in my ward compete to have the lowest tobacco, box of cigarettes and so forth, whether it's methyl or methane. What is the menthol? My parents were smokers. I think I tried my first cigarette when I was 9, because I was a latchkey kid that was at home, and when my parents weren't there and they had cigarettes all over the place, I tried it. I've seen it in the movies. I thought it was something you did. I honestly thought it was to relieve stress, which I will say for years, I wasn't a consistent, you could say I was a closet smoker, and I would know it was wrong. It would hurt my lungs, but I thought it was something you're supposed to do to relieve stress. And I would be smoking and saying, this hurts, why am I doing this? Because this ain't relieving no stress. And I understand my father stopped smoking about 12 years ago. He had surgery. When he came out of surgery, he couldn't breathe. He was on a breathing machine. I said, hey, you gonna stop smoking after this? He said yes. He swears to me he never did that. He was under anesthesia, but he didn't smoke after that. I work in a barbershop. That's my other part-time job. And we eliminated smoking in our barbershop after that. And it really made a difference. I didn't realize how much smoke, even if you weren't a smoker, that you inhale just in, secondhand smoke. The walls had nicotine on. We had to wipe that down. Looked like the roaches liked it too. I don't know. And then my mom, same thing, had thyroid surgery about 6 years ago. Got out of surgery, lung collapsed. She hasn't smoked since. So I am a product of parents that smoked, and I tried it, and I thought it was something you were supposed to do until I got older and actually started to date men that said they didn't like women that smoked, and they thought it was nasty. And so I thought, oh, well, that's a different way to look at it. I'm going to put that down. So I don't want my community to be subjected to this is what you're supposed to do. I really am offended by the different flavors to attract kids. And as a barber and going to barber school at that time, it was flavored cigars. The Black and Mild was a popular thing, and they did taste good, but it was detrimental to lung health. It was horrible. So what you think about the birthday cake flavor? It's pretty good, isn't it? Yeah. But yeah, I'm not going to smoke this thing. So I just wanted those that were going to leave to be able to see this. There is nicotine in this. As my understanding, the FDA does not regulate this, but will in 2017, but has considered this to be a tobacco nicotine product. And I know that the e-cigarette companies say that this is a sensation product, not a tobacco product, so that's why they're trying to not have it regulated. I spoke to someone that said they actually smoked this more because they thought it was healthier for them, and because it was so good, they smoked more often, and so they probably really don't know, and we really don't know. There's traces I've read in this bill of formaldehyde, nicotine, all kinds of chemicals, and we don't know what's all in this. We say it is something to help you get off of smoking, but honestly, I'm not gonna mention the alderman. I've seen them smoke, then go to e-cigarette, then go back to cigarettes. And Alderman, there are also other ways to stop smoking besides an e-cigarette. There are actual medical things, the patch, the nicotine gum. There are things and ways that you can stop smoking. And Alderman Larry, I quit smoking a long time ago, but the weight still comes whether you smoke or not. So I'm not going to pick up smoking and get rid of it. I'm just going to get moving. So I'm like Mrs. Obama. I'm going to move on. I'm going to just keep on moving and get rid of it. So if you all don't have any more questions, and Craig Schmidt, did you want to say something from the health department? Did you want to get up and please give us?
So yeah, I'm going to be shorter, Madam Chairwoman and members of the committee, than I used to be when I was here, because I know you want to take this vote. I'm just here basically to let you know that your local health department is supportive of this bill. It's my understanding, and you mentioned this a moment ago, that a lot of people do smoke both tobacco cigarettes and the e-cigarettes. This is one of the fastest growing products. The e-cigarettes, and it's overtaking cigarettes, as they indicated. There's really nothing good that comes from any of this. I know we talked about the military situation. Obviously, the bases can regulate that. I think the important thing here is that we're talking about our kids in civilian life in the city of St. Louis. We're giving messages about what's good and what's not good. In military, the reason why they want you that young, they want us that young, is because they can mold us. And the reason they can mold us is because of the prefrontal cortex. And so if we want to bathe that in nicotine, that's fine if we're an adult because we're making choices. But if we've made that choice when we were 12 or we were 17, 18, you know, it would be good to move it to 25, but nobody's going to support that. So that's really the effort. So I think you've hit the nail on the head. You've heard all the great experts on this. And part of my job is dealing with policy and legislation in addition to things like trauma and heroin and all these other things. So this is an important piece that you're doing here. It's not the end-all and be-all for everything, but it's an important piece.
And, you know, our enforcement is, we're going to, the police department is written in this bill, which is something I've always wanted, because even before Tobacco 21, I wanted to have some regulation of them going in and being able to buy single cigarettes and so forth, and we really didn't have anyone to enforce that, and the officers weren't able to write tickets with that. And I believe our tobacco
Alcohol, tobacco.
yeah, that pretty much was disbanded, and we just don't have those people
In the state.
that regulate those stores anymore. So,
St. Louis County is fortunate. They were prescient enough to have a vote in terms of some additional fees for that additional. So the way the city will do this is the way we do all things, is to react to complaints about that. So that's the way that would operate.
so according to the bill, the health department will be able to go out just like they do the non-smoking inspections and so forth to
It would work the
businesses.
same way,
And the
correct.
police department, the nuisance department now has their officers doing trash task force, liquor, and they will also do tobacco and so forth. So we'll have two entities out there trying to check on this. You know, as an alderman that's on the county-city border, I think it's important that, you know, people know that they can do certain things in a city, and when the police are called on them, they run to the county, and vice versa. And I just would hate that. Nance School is right there off of Hawes Ferry Circle. That's the school that my son goes to. And they can just go right on the other side of the circle to BP. I want it to be uniform across the board. Yes, we can't stop tobacco from getting in the hands of all our youth. Yes, we know that some parents smoke with their children. We know that other family members will allow their children to smoke as they allow their children to drink. But I have read some things that have said that even the age of 21 in drinking has also spared a lot of our children health-wise, in accidents, traffic accidents, less of them, as well as health effects with the age being raised and being 21. 26 years ago, I was 21. I couldn't wait to be 13. I couldn't wait to be 16. I couldn't wait to be 18. I couldn't wait to be 21. And at 47, I'll be perfectly honest, 21 was not all of that. I prefer to be 25. To go back to those days and try to start over. But I think 3 more years of trying to save children. And nowadays, a lot of the older adults, mature folks, are starting to not smoke because they know of the effects of their health. And I think with the parents that are trying to improve their health and trying to live according to that, it will have an impact on their children if they're not able to go out and get until they're 21. And like you said, the mix between a 13-year-old, 18-year-old, 21-year-old, it's not much. There are mixes, but you can't be 21 until you go into a bar. I know we have the smoking ban, but in some places you can, you know, if you are 21, you can drink. If you're 21, you can smoke. Otherwise, underneath that, you can't do that. So I just think if this is going to be looked at nationally, we can come on board with the other 211 cities, the other states. And again, it's not the end, it's not the solution, but I think we can probably help a lot of children because they become lifetime smokers at a younger age. It's harder for them to actually kick smoking if they start younger. And they end up becoming lifetime smokers. I think I saw something that 1 out of 3 children will end up having lung or respiratory illness, disease at a younger age starting out. So
we appreciate if you deal with these. This is less difficult to
Right.
deal with than many other things. So this is a simple solution to a massive problem.
yes, it is. So thank you, Craig. Anybody have any questions for Craig? Yes, Jeffrey?
No, I
Sorry,
don't.
Alderman?
I had a question of you, actually.
Yes, Alderman.
Okay, thank you.
one of the things that I was kind of concerned about, it was the single cigarette issue. And I was looking in here to see about what the enforcement was like. And then you mentioned about all these entities or departments are gonna start looking for that and enforcing it. So who would actually issue a summons to an establishment that sells a single cigarette?
So if you think that there's a business in your ward that's selling single cigarettes, I believe our nuisance team under Sergeant McLaughlin and our problem property officers will be able to go in and actually check on it. I've had my neighborhood liaison go in and actually check on a business, but unfortunately, he doesn't have the ability to write a summons.
Only the police would be able to write the summons. So they need to go in undercover or something, or?
They have a way that they do it. I know that they have gone in undercover, because I don't know if you've met the whole nuisance team, but there are some that aren't in uniform, particularly the trash task force people I've seen. They're not always in uniform. They're also the ones that go to the liquor establishments to make sure that they're doing right, but yes.
Well, I'm glad we're looking at that, because I know I get a lot of complaints from businesses that are doing the right thing, and so many other businesses allow people to buy single cigarettes. So I just want to get a better understanding of that. And I also want to make a confession that, and I know we spoke last night, because I wasn't sure if I could support the bill, being that I was, served in the military and have been
Pull your
exposed to
microphone
it.
down so we can.
I was just saying I was concerned that maybe I couldn't support the bill, having served in the military, been exposed to people smoking, thinking about, where at age 18, if you can serve, then that's a liberty that you should have if that's what you want to do. And then getting, conflicting messages about how we treat 18-year-olds and how we say in the justice system that at 18 you can be tried as an adult. And we put so much pressure on 18-year-olds as how to act as an adult when they're not truly an adult. So that kind of bothers me when we want to incarcerate somebody, basically a kid at 18 or 17 often as an adult. And then we talk about, smoking, because certainly, I'd rather see them smoking than going to jail, for the rest of their life on something that, they really didn't have to because of how our justice system works. But when I heard the testimony of the military, and what's your name again? Carrie, you did a great presentation. I had to do some really quick research, and what I did find, and I was excited to find it before it was brought up by Hawaii, that, they went along with the state, even though they didn't have to, and so I was encouraged by that. And the other, over the years, I noticed as I was kind of Googling and reading that, this is something that the military has, taken up as an issue, and they're real serious and concerned about it. And it just really, really made it easy for me to be supportive of this. If the military is supportive of it, even though you can join at the age of 18, and, then I'm certainly going to be supportive of it. So.
Okay, thank you, Alderman. When we spoke last night, I respected your stance, but I kind of had a feeling also today that once you heard a little bit, that you might be able to be okay with it. So at this time, I know some folks got to take a potty break, so we're going to go ahead and take this vote, because I got to go too. I done drank too much coffee this morning. So I would like to, trying to get my words together here. I'd like to make a recommendation that we pass Board Bill 169 out of committee with a do pass recommendation. It's been seconded by which one you want to take? Alderman from the ninth. Okay. Madam Clerk, please call the roll.
Alderman Ortman.
Aye.
Alderman Boyd.
Aye.
Alderman Williamson.
Aye.
Alderwoman Behringer.
Aye.
Alderman Cone. Alderwoman Howard.
Aye.
Alderman Arnowitz.
Aye.
Alderwoman Hubbard. Chairwoman Flowers.
Aye.
7 aye votes do pass.
I would also like to be a co-sponsor on both of these bills. Be added.
Yeah, and Alderwoman Angracia would like to also be a co-sponsor of both bills. Be the sixth one. And add the Alderman from the ninth, please. Okay. Now we're going to take up Board Bill 170. I make a recommendation that we pass out Board Bill 170 with a do pass recommendation, seconded by the Alderman from the ninth.
Previous roll.
Previous roll. Hearing no objection to previous roll, Board Bill 170 passed out of committee. I thank you all for coming early. I wanted to get in before the Intergovernmental Affairs meeting, and I'm sorry for those that didn't get to speak, but I think we got a pretty good slam dunk on that one. So we'll see what happens on the floor of the Board of Aldermen. Thank you very much. I appreciate it.